The Best Docs Network helps you find some of the best doctors utilizing the latest procedures and practices in healthcare. Actual patients and the doctors themselves walk you through their stories that together help you make the best decision in your search for the right doctor. On today's episode, podiatrist Dr. Gabriel Maislos treats his patients' chronic foot pain caused by plantar fasciitis. Craniofacial and plastic surgeon Dr. David Jenikov talks about his approach to facial rejuvenation with his patients. ENT Dr. C.T. Wynn treats his patients' chronic sinusitis. Prosthodontist Dr. David McFadden talks about complete mouth restoration using implants.
I had a bad problem of grinding my teeth. And 30 years ago, I had some beautiful teeth. And, you know, they slowly got worse and worse and worse. And then, of course, I started having cavity problems. And my regular dentist told me, look, they're not going to last your lifetime. So you're faced with either dentures or you know, redoing your mouth.
Many patients find us because they're at the end of the road on their dental history. They have neglected their teeth, or they've had habits that have caused their teeth to wear down to the point where they know they have to do something. And they present sometimes after many decades of problems, and they're ready now to fix those problems the best they can afford to. A lot of the patients fall into the full mouth reconstruction category, which means they need every tooth in their mouth addressed in their treatment.
When I finally went to Dr. McFadden, I was looking to him for a permanent solution and something that would last the rest of my life, obviously. And then calmly brought me into his office and literally wrote down on a piece of paper, here are 3 different proposals. After weighing it, I decided to take the highest cost option for me, which was to put crowns on every tooth.
When Bob came to the practice, it was a really fun appointment. He was instantly charming and fun to be around, and we became friends throughout his treatment. When Bob arrived, he had had 4 decades of tooth grinding and ended up with almost no tooth structure left, and his wife hated his smile. We were able to use all of his teeth and perform certain procedures to allow him to keep his natural teeth and improve the way they look through crown treatment. One of the funniest things about Bob is that he carries his before and after pictures on his iPhone. He shows everybody. He shows people that don't care at all what his teeth look like and how great his teeth look now.
He cares, incredibly cares, how good your teeth are. A little bit obsessive compulsive he is, but it works out in your mouth to be beautiful.
For more information on this doctor, call now or go to bestdocsnetwork.com.
Did you know that establishing a bedtime ritual helps your body know when it is time to sleep? You can establish a bedtime ritual by doing the same things, such as brushing your teeth, reading a book, or listening to soothing music every night an hour or 2 before bedtime to relax your mind.
Mr. Weber, he basically came in with typical symptoms of plantar fasciitis. It hurts in the morning, or I can't play golf because I'm just always in pain. And
plantar fasciitis, as anyone who's ever had it, it's pretty painful, very, very painful, especially getting up in the morning. And
plantar fasciitis is a pain that I honestly in my practice I probably see 10 to 15 times a day. So typically someone complains about that first step in the morning when they get down. When you bear weight, okay, your arch actually collapses and your foot gets longer, and this ligament-like structure that's on the bottom of the heel pulls from the heel bone. So when it pulls from the heel bone, you get inflammation. Inflammation triggers the pain cycle. So essentially, every time that you're bearing weight, you're restarting the pain cycle, and it's chronically inflamed tissue on the bottom of the heel.
Well, I have to say that this procedure is really amazing. After the recovery time from the surgery, it really is immediate relief. Immediate.
The 10X procedure is basically, it's an ultrasonic device that allows you to debride the scar tissue. So when you have plantar fasciitis or any kind of inflammation of a tendon, you develop scar tissue. And so using ultrasound for guidance and using like a micro tip, you're able to debride the scar tissue, remove it, and basically start the healing process. The key feature about it is that it's a single incision, one suture, and the patient can weight bear immediately after. So it's cutting edge technology combined with minimal incision surgery.
It's really remarkable. I mean, it's truly remarkable. I don't have any pain in the area that it affected me. It was really, truly amazing.
It's a 15-minute procedure. It's very precise because you're using an ultrasound machine for guidance, so you can actually visualize the plantar fascia. And it's minimal incision, literally just one suture on the inside of the heel. So it's not on a weight-bearing part, so you can immediately weight bear after the surgery. Patients love it, and so I love having this as a new thing I can introduce to my practice.
For more information on this doctor, call now or go to bestdocsnetwork.com.
Do you have missing teeth, need crowns, veneers, partials, dentures, or a full mouth reconstruction? Prosthodontist Dr. David McFadden will give you back the youthful appearance and confidence you deserve. Backed by credibility and credentials, Dr. McFadden is cosmetically changing his patients' lives one smile at a time. Call today or log on to dignitydental.com. Dr. David McFadden, your go-to dentist in the Dallas-Fort Worth area.
I didn't feel good about myself and I never wanted to go anywhere. Now my world has opened up. I occasionally go out with my girlfriends and we have a great time together.
I was getting older and didn't really care about my weight, but my doctor said I needed to do something immediately. Now I'm spending time with my grandchildren and every moment seems special.
My one reason was to live life again.
My one reason was to simply live.
So what's your one reason?
Barker Bariatric Center. Log on or call today for your consultation.
And we are excited to have in the Best Docs Network studio Dr. David Genicove. He is the owner and director of the Genicove Plastic Surgery Group, one of the best plastic surgeons in the state of Texas, and operates right here in the Dallas-Fort Worth area. Dr. Genicove, welcome to the program.
Thank you, Jim.
All right, let's get right to it. If I come into your place, anyone else come into your place, they want to look younger. There's no doubt about it. So if you're consulting with an individual and they come in and say, hey, I want cosmetic facial plastic surgery, what do you do?
Well, anybody that comes to the office is really kind of unhappy with something about themselves. And usually when they come in with an issue about their face, we get comments like, I now have my grandmother's neck, or I look just like my dad, or I'm out there trying to get a job and I'm competing with people that are 20 years younger than me and I look 30 years older than them. How do I get back to a more competitive position? And so we start to talk to them. I talk to them about what their goals are. And so sometimes they think they just want surgery, when in actuality they don't really need surgery at all. They could use some non-surgical treatments with injections or fillers, or even some skin therapy. And those kinds of things will highlight some of the patients just enough so it'll get them where they need to go. Additionally, if they do need surgery, we do a full physical examination and really try to find out what it is that is bothering them. And so it's that detailed conversation with the patient at the very beginning that helps guide what kind of treatment that they're going to get.
Okay, now for an individual that comes into your practice and says, I just want to look better, what do you tell them?
Well, I have them look in the mirror, and that's where it all starts. We put them in front of a mirror and say, what is it that you see that you'd like to change? And so we address the eyes and the nose, the area around the mouth, and the jowl and the neck, and we look at each one of those, and then I begin to kind of move things around for them and show them what it looks like, what the options can be. Then we'll take some pictures and we'll put them on the computer. And I don't use the computer as more of a selling point, as this is what I can do. It's more of a center so that we can talk about what it is that the patients want. Because ultimately, for me, a happy patient is a patient who understands what it is that they want and has realistic expectations.
All right, I find this interesting. Your background is in cleft and craniofacial plastic surgery, okay? So, when someone comes in and wants facial rejuvenation or facial cosmetic surgery, what is your approach?
Well, because of my training, I've dealt with all the layers of the face, including moving bones. And so sometimes when we look at aesthetic surgery, it's not just skin and soft tissue. As we get older, the bones tend to recede a little bit. They tend to flatten out as well. And sometimes actually it's moving bone that can give you the projection, which is actually considered very beautiful. In my training in cleft and craniofacial surgery, and actually real good bone surgery of the skull and the face, allows me to approach the patient with a few more tricks in my armamentarium than maybe other people might have.
There we go. All right, Dr. David Genicove, the owner and director of Genicove Plastic Surgery Group. Great to have you. Appreciate it.
For more information on this doctor, call now or go to bestdocsnetwork.com.
Let's talk about pink eye. Pink eye is an infection of the lining of the eye. It's called conjunctivitis in medical terms. And it can be caused from bacteria, in which case you need certain types of drops for your eye. And it can be caused by viruses, and that's the more common cause. Now, you can tell if it's a virus in that the lymph node right here in front of your ear will be swollen and tender. That's because it drains the eye. Now, if that lymph node is tender and swollen, that's usually a virus. So you don't need antibiotics, you don't need antibiotic eye drops, but you are contagious. Now, if you have thick, creamy, ugly pus that comes from your eyes, they're stuck together in the morning. That happened to me a lot when I was a kid. That's usually a bacteria. That little lymph node won't be swollen. You will need antibiotic eye drops, and it'll probably be contagious. Now, how long is it contagious? Well, a virus can be contagious for weeks and weeks. Bacteria is usually just a few days. Generally, once the redness starts to go away, about 12 hours later, you're no longer contagious.
My symptoms were like I would always wake up in the middle of the night, having short breath, and then on the baseball field, like I'd be the one bending over all the time. I was the only kid on the team that would always be slouched over, trying to grasp for a breath. And I would say that was my major symptom right there, my major problem.
Aaron is a young athletic teen whose mom brought him to see me because he was never been able to breathe through his nose. He feels tired all the time, and he complains that he doesn't have enough oxygen. He feels like he's short of breath.
I've been to several different doctors around Houston, and they've always thought it was asthma or something else, but Dr. Nguyen has taken his time to actually look into my nose and go further into seeing what was wrong with me.
When I examined Aaron, I noticed that he has a severe deviated nasal septum combined with enlarged turbinate. The turbinate are the swelling part on the side wall of the nose, which contribute to more than 75% of his nasal obstruction. We discussed those findings with his mom and him and decided upon a plan of treatment that consists first of correcting his septum and using energy radiofrequency coblation to reduce the swelling on the side wall of his nose, therefore increasing his nasal passage and increasing his oxygen intake.
2 months out of my surgery, I feel like I can breathe a lot better. It feels like my performance in baseball has improved. It feels like I'm getting a really good night's rest every night. It just seems really amazing to finally get that breath of air that I've always needed.
Aaron's surgery was performed in an outpatient surgery center. The procedure took around 45 minutes and Aaron goes home the same day.
Dr. Nguyen has forever changed my life. From when I was born to now, I could not breathe and now I can. We just appreciate what Dr. Nguyen has done for my life.
For more information on this doctor, call now or go to bestdocsnetwork.com. Request an appointment on bestdocsnetwork.com. Coming up on the second half of today's show, interventional cardiologist Dr. Annie Varghese talks about the dangers of heart disease in women. Cosmetic surgeon Dr. Michael Thornton explains the benefits of fat transfer for facial rejuvenation. Plastic surgeon Dr. David Altamira gives his patient the looks she's always wanted. Facial plastic surgeon Dr. Yadro Ducic gives his patient a more balanced face with rhinoplasty and a chin implant.
I've done dance a majority of my life, ever since I was about 2.5 when I first enrolled in tumbling. And over the years, with mirrors and makeup and performing, I kind of realized something's wrong. I noticed my nose was not always the best it could look.
Well, rhinoplasty essentially means reshaping the nose. When you look at the nose, it's in the middle of the face, and we don't really want to draw attention to the nose, whether it's positive or negative. The whole point is you want people to look at your eyes, you want them to look at your smile, your mouth, your overall facial appearance, and the nose you don't want to be a distraction. In terms of aesthetics, you really want to make the nose fit your face.
Dr. Ducic is very open, he's extremely funny, he's very relatable, he gets very involved with his patients. He really tries to figure out how and what needs to be done to get the achieved goal.
In terms of when to have a rhinoplasty, appropriate age is when patients are mature enough. You have to look at the facial features and facial growth. Sometimes you can do corrective nasal surgery on patients as young as 13 and 14 if their facial features are fairly well developed. Sometimes they're not ready till they're 17 or 18 or 19, and so you really have to individualize it. It's important to have a nose that is appropriate for your facial dimensions. You don't want a nose that's too small and somebody with wider cheeks. You don't want a nose that's too large or too prominent. And so it really is a matter of balancing it with the rest of your face.
He explained to me that, the balancing my face was off. He not only recommended a full rhinoplasty job for alignment on my nose, but he also recommended a 4mm implant to my chin and my jaw, so that it could help balance out my face. Now, to this day, about 4 or 5 years later, it has definitely made an improvement. I'm definitely more confident. And now with my greater confidence, I've actually been able to have some modeling opportunities and gotten to actually show off my new presence and appearance.
For more information on this doctor, call now or go to bestdocsnetwork.com.
I came to see Dr. Varghese on the advice of my primary care physician because my blood pressure was a little elevated and my EKG reading was a little off. She suggested that I take a stress test and have some other procedures done just to determine the causes of that. And it was determined that I did have blockage in one of my arteries and a stent had to be implanted. And then reality sunk and Dr. Varghese talked to me during the recovery time, and I asked her, in tears, I asked her what was going on. I asked her, was I about to have a heart attack? And she said,
Yolanda Garcia, to this day, she's so thankful that her primary care was cognizant enough to send her for evaluation, because many times primary doctors or nurse practitioners who see all of these patients, they may not recognize because the patient's not complaining much. So I think this is a wake-up call for all of us as physicians and healthcare providers to really focus on prevention, evaluating the patient early, getting them to the right specialist on time.
Because of her, I'm able to take care of my clients. Because of her, I have a better life. So I really am appreciative of all she has done for me.
Well, coronary disease in women especially is, it's the #1 killer of women in this country, and pretty soon will be the #1 killer of women all over the world. And in Hispanic women especially, there's a high prevalence of diabetes. So therefore diabetes lends towards cardiovascular disease and coronary disease especially. It's just so important to educate our Hispanic population, our Indian population, because Indians die 4 times the rate of any other population from diabetes and cardiovascular disease. People are hungry for knowledge. It's just for the lack of knowledge we perish.
For more information on this doctor, call now or go to bestdocsnetwork.com. Ask our doctors on bestdocsnetwork.com.
When people hear about facial rejuvenation, it's more than just surgery. It's all about non-invasive procedures, including fat transfer, lasers, Botox, different things that you can do to the face. So it's not always about surgery. So when I say facial rejuvenation, you're just improving the face. You're not actually performing major surgery on the face. One of the things that I found to be very successful as part of the facial rejuvenation procedures is fat transfer. Facial rejuvenation using fat transfer is very effective because you can use it on men and women. Especially a lot of people who are trying to get back into the workforce. They're coming in and they just want something really quick. They want something that they can get done and within a matter of a couple of weeks they're back on track. So fat transfer is really good for that. You can put it in different areas of the face, like lifting the eyebrows. You can put it under the orbital rims and the nasolabial folds. You can put it in the lips. And then you can do some laser work. And just little simple things like that can take the patient a long way without doing major surgery. Fat transfer is basically taking fat from another part of the body, harvesting it, and rinsing it of all of the oils and then putting it back in somewhere else. We put it in particular spaces within the face and it stays there. It's not just a gel-filled area. When I put it in, it does stay. It doesn't move around. A lot of people ask that question. But it's their own fat, it's their own body, and so there's not going to be an immune problem or a rejection problem or infection. The complications are relatively low as long as you use good surgical techniques and adhere to good surgical techniques. It's known to last for several years, if not forever, but you have to also remember that the body and the face do change over time. So you're going to lose weight, gain weight, the facial anatomy is going to change, the bone structure is going to change, the soft tissue will change. So it's a procedure that lasts a lot longer than your hyaluronic acid fillers or these dermal fillers that we put in. And I usually use those for temporary results that you maybe want to get 3 to 9 months out of. But if somebody wants longer lasting effects, then I'll use fat transfer.
For more information on this doctor, call now or go to bestdocsnetwork.com.
Carla has a question for Dr. Peter Morgan. What are the causes of venous insufficiency?
The risk factors or causes of venous insufficiency are, first of all, genetic or hereditary. Patients that have parents or grandparents or aunts or uncles that have large varicose veins are more likely to have disease that is caused by a genetic predisposition for the veins to get larger. The second risk factor is lifestyle issues, including jobs, occupations, or hobbies that result in standing or sitting for long periods of time.
I probably wouldn't have done it if my wife had not persisted and said it meant something to her. The discussions about my health and my heart and how the teeth over time could affect it, and that I finally gave in and did it for my wife.
Ed comes in and he wants to get all this work done, and so we basically did a full mouth on him. And his teeth were broken down. He had had some dental work a long time ago, but it had basically gotten redecayed and some problems there. So he needed to have a lot of this done.
The thought of being able to come in and get it done, I'll say one sitting, although it's pretty long sitting, was probably the the appeal to doing it that way.
So we did the smile lift on Ed, where we opened his bite some, and to get them in a better position, increased the color, made them whiter, brighter, and got them more in alignment to where they weren't hitting all different places. And the results are amazing.
Not like any dentist experience I've ever had. And I had thoughts when I was young about being a dentist, and had a couple good family friends that were dentists, and the experience was nothing like any dentist I had been to.
He's busy, but he was able to come in, and we could do this in a couple of visits and get the major things done. These are normal results for us, but you look at it and it's pretty dramatic. But that's what I get to see every day. That's what I love about my work. You get health, get things cleaned up and looking good, but also make it look awesome.
Again, I don't smile too often, but it's amazing how many people stop me, whether it be a TSA agent at the airport or a waitress or someone I'm doing business with that says, boy, how beautiful your smile is. And as a man, I'm reluctant to say, oh, well, yeah, I've had cosmetic dentistry. So I just kind of say thank you, and I said, I've been blessed, and I have. When I look in the mirror and smile, yeah, it makes me feel good now.
For more information on this doctor, call now or go to bestdocsnetwork.com.
You know, I just always felt like my body was out of proportion. When I would try on clothes, it was never when I looked into the mirror what I envisioned in my own mind. So I guess that's what prompted me to start researching and looking online. I never felt like my full potential.
Karen came in just wanting to have bigger breasts because she'd always felt that her breast size was out of proportion to her hips. She'd always wanted to be a little bigger. She just felt she needed it to kind of balance out her shape. So she was, after discussing it with her, a really good candidate for that.
As soon as I met his staff and him, I know he had that attention to detail. Just speaking to him, something about him set him apart from the others. He just made me feel safe. I knew I could trust him and his work.
So there's a lot of factors that go into it. By taking the measurements and using them carefully to that particular patient and matching it to the size of the implant, we can give them a good, aesthetically pleasing size and shape that looks good and matches their body.
It was an outpatient procedure, so I came in that morning. The same day I was out and back at home. It was a really good experience.
It really made a huge difference in her confidence and self-esteem. It may seem like a small thing to someone who didn't know her or just a casual observer, but in her mind it made a world of difference. It just really changed her personality. She kind of brought her out of her shell. She just felt better in a bathing suit, in photographs, just being out socially. So it was really a real blessing for her overall.
Before my breast augmentation, I was wearing a size A. And after the augmentation, I was a C. I had already decided I wanted a very natural look, and that's something that's very important to me. That is what Dr. Altamari gave me, a very natural look, and I'm very happy with the results.
For more information on this doctor, call now or go to bestdocsnetwork.com. Didn't find the doctor you're looking for on today's episode? Head to our website, bestdocsnetwork.com. There you can search our video library by topic, specialty, and doctor. The Best Docs Network, helping you find the right doctor and bringing medical education to you.